This study sought to find the effectiveness of ACT sessions on acceptance, diffusion, and mindfulness of children by Lindsey, Ellenberger, Kimberly, Forst, Lauren Lang, Rebecca Marshall, and Rylie Spriggs. ACT stands for Acceptance and Commitment Therapy. It's a form of behavioral therapy which suggests that mental and emotional health is influenced by how people relate to the world through verbal descriptions of psychological events. The goal of it is psychological flexibility. And there are 6 processes within this: acceptance, diffusion, present moment mindfulness, self as context, chosen values, and committed action. For this study, we focused on acceptance and diffusion. In a study conducted by Pankey 2014, ACT skills in a training package showed a reduction in levels of stress, hyperactivity, and emotional distress. The purpose of the current study was to evaluate the effectiveness of ACT in improving the psychological flexibility of 5 children with and without developmental disabilities. There were 5 participants with an age range of 7 to 17. Nick was 7, male, and he had disruptive classroom behavior. Huck was 7, male, and he had classroom disruptive behavior. Logan was 9, male, and he had autism. Ryan was 9 and male. Lastly, Anne was 17, female, and she had multiple medical conditions. Multiple settings were used in this study. Nick and Huck were in their classroom, and Logan and Ryan had sessions conducted in their family's living room. The materials used were pre- and post-assessment tools. The Avoidance and Fusion Questionnaire for Youth, AFQY, was used, and the Child and Adolescent Mindfulness Measure was used, the CAM. The dependent variable in this study were the total scores on the AFQY and CAM assessments. The independent variable were days 1 through 10 of ACT activities. The procedure consisted of 3 steps. First, pre-assessments, AFQY and the CAM were administered. Second, ACT interventions consisted of days 1 through 10, which focused on acceptance and diffusion. First, there was a brief 2 to 3 minute check-in, then the session, then hands-on activity relating to the session, and then a short discussion. Lastly, post-test assessments were conducted. On the AFQY, higher scores meant greater psychological inflexibility. Participants 1 through 4 showed a decrease, while participant 5 was an outlier and showed a slight increase. On the CAM, higher scores meant more mindfulness. All 5 participants showed a 5% percentage increase from pre to post. Displayed here on Figure 1 is a bar graph of participants' AFQY scores, pre and post. As you can see, Participant 5 was an outlier, and participants 1 through 4 all decreased in flexibility. Shown in Figure 2 is a bar graph of participants' CAM scores pre and post. All participants increased mindfulness. Displayed here is a table displaying participants' AFQY and CAM scores before and after the ACT intervention sessions. While the results indicate that this study was highly effective, there are multiple limitations. For one, 2 of the participants were twins, one with autism and one without. So this could have been a factor in the way they answered questions, and they came from the same environment. 2, there were various settings for subjects. And 3, different experimenters conducted the session, so procedural fidelity could have been lower. Future research can extend upon this study by obtaining participants that are not from the same house, having a consistent setting, having different settings for all subjects to generalize results, having group ACT sections, employing better procedural fidelity tactics, and implementing the other processes, such as values and committed action. Here are the references used in the PowerPoint.